So we are now officially recording. Thank you all for joining us here today. We're going to talk about our employee benefits program with the effective date of May 1st, 2022. My name is Bill Hammett. Happy to help with anybody that has any issues, any questions. Me and my staff are available to help you find doctors, help you understand the plans that are available to you, whatever it may be now during open enrollment or throughout the year, claims issues, all the different kind of things. Healthcare can be, and health insurance can be kind of difficult. So if we can step in and help you, please lean on us for that. Quick agenda, we'll just talk about open enrollment, the dates, the benefits. We'll spend a little time going over the actual benefits, talking about some terminology, changes you need to know about, how do you enroll, and then I'll stay on the call for as long as there's any questions or and if we need answers, I'll be here. As a reminder, next week at this exact same time on the 12th at 11 a.m., we'll be doing a live Q&A. If there's anything throughout this process that you have questions on, please jump on that call and we will go over them. It'll be a total free form, open forum type of thing. So open enrollment. So today's the 5th. We're asking everybody to log in and to make your choices by next Friday, April 15th. This should be relatively easy for many of you because when you log into the system, if you're already enrolled, you'll see that the plans that you have currently are pre-selected for you. So if you don't really want to make much in the way of changes, you'll just click right through there and you'll be all done. So please help us out by doing that. As a reminder, this is your time to make any changes you want. It's your chance to enroll if you waived previously. It's your chance to terminate the dental plan if you didn't use it. It's your chance to do all kinds of stuff, whatever it may be that you want to do, adding dependents, removing dependents. This is the time to do that. Any changes that you make will be effective May 1st, 2022. As a reminder, we're asking everybody to be done with this process by Friday, April 15th. And you will complete your applications online at the Ease Enrollment portal. This portal, I will do kind of a live walkthrough with you as well. So that's the specifics. So let's talk about medical plans. We've got 8 plans for those of you in California. For those of you outside of California, we have 6. Now there's basically matching plans: 2 bronze, 2 silver, 2 gold PPO plans. Now, what is the difference between these two? There is a pretty specific difference you should know about. So the tandem PPO is going to be the smaller of the 2 networks. Okay, this is going to be not as many providers. For those of you in California that want a PPO plan, that want the freedom of having a PPO and being able to go to different medical groups and different facilities, but aren't super tied to very specific ones, the tandem could be a really great option for you. For those of you that are out of state, the same network of providers are available to you. So for you out of state folks, you might as well select the tandem network plan because when you're outside of California, you're using the Blue Card network, and this is the same network of doctors that you'd find in the full PPO network. All right. Full listing of providers at blueshield.ca.com/network tandem PPO. All right, so that's how you can find the full network. So if you're like, well, hey, I don't mind saving a couple of bucks. Let me look for my providers. Let me look for the facilities that are important to me. You can find that at blueshieldca.com/network tandem PPO. So we're going to look at our 8 plans real quick, side by side. So here's our bronze plans, and you're going to see it laid out like this for the next 4 slides. It's our tandem PPO plan, which equals fewer providers inside California, and then our full network PPO, which is for California employees, the largest network of providers. Once again, for those of you on the tandem PPO plan that is and you're out of state, you've got the full network anyway. So bronze PPO plans, bronze plans in general, are really great for any of you that don't really have much in the way of medical needs. You just want the cheapest plan you can get. You just want a catastrophic type of health plan, something that'll be there for you in case you have a major catastrophic event. And these bronze plans are great for that. They're going to be a very low premium, all right, meaning your per paycheck cost for these plans is going to be much lower. It'll be the lowest that you'll find out of any of the plans available. But the flip side of that is if you need to use it, if you go to the hospital, if you have surgery, you go to the emergency room, you need an MRI, you will pay the most for those services with the bronze plan. All right. Now, on all of these plans, I want you to look at this out-of-pocket max. All right. $8,350. So if you're on this bronze plan here, you're going to pay a maximum in a calendar year of $8,350. So if you have $1 million problem, once you've spent $8,350, you're covered at 100% for the rest of the year. All right. We'll talk a little bit more detail about benefits in the coming slides. Also, just as a reminder, if any of you have any questions on any of the slides I'm currently on, go ahead and unmute yourself and ask the question. Feel free to interrupt me. If you got the question, somebody else does too. So just a quick note on that. Another note about bronze plans, very high deductible, $6,850. So if you take this bronze plan, for the most part, you're going to be asked to pay for everything up to $6,850. Now, they do give you some copays for doctor visits, $55 for a regular doctor visit, $75 for a specialist, and you get 3 of these at a copay. After the 3 of these visits have been used up, you will then be paying 100% of the cost for the doctor visit up to your deductible. All right. The tandem PPO plans have a different prescription drug benefit. So they have a tiered prescription drug benefit here. So if you go to level A pharmacies, you will pay less than you would for level B pharmacies. So when we get into the enrollment portal, I'll show you where you can find some of this information. At the very bottom, you'll see urgent care, $55. These urgent care doctor visits and specialist visits are a combined 3 together. So if you did 3 regular doctor visits, that would be all the visits you had. If you did, you could do 1 regular, 1 specialist, 1 urgent care, and that would be 3. Okay, so pay attention to the limitations of the bronze plan. The premium amount coming out of your paycheck is going to be very attractive, but you are going to be on the hook for a lot of upfront dollars should you need to use it. Here's our silver plans. On this silver plan, this is one of our most popular plans that all of you have chosen. And so I'm just going to kind of roll through what these benefits look like here and just kind of go through some of the terminology. I will not be doing this for every plan. I think that once you hear me go through it once, you'll kind of get it for the other ones. So from the top, we have a deductible of $1,800. A deductible is, generally speaking, what the insurance company says, you must pay all of this number before we start paying anything. All right, so we notice on our bronze plan, that's $6,850. On our silver plan, that's $1,800. So it's a much lower deductible. And then below, we see our $8,350 out of pocket. So when you look at the silver plan versus the bronze plan, you'll notice the out-of-pocket max is exactly the same. So for that catastrophic issue, these 2 plans would perform exactly the same. You would buy the silver if you don't really want to be stuck with a whole $6,800 deductible. Okay, so that's your max out of pocket, which includes a deductible. Now I want to call your attention to this terminology here in parentheses, DED waived. You see it here, you see it for diagnostic lab and x-ray, you see it for this is physical therapy, occupational therapy, speech therapy. So these rehabilitative or habilitative services, deductible waived, chiro deductible waived, all the way down here at the bottom, we've got urgent care deductible waived. Wherever you see the term deductible waived, this means you do not need to meet your $1,800 deductible before you get these copays. So if you have the silver plan here and you need to go see a doctor on day 1, on May 1st of this policy, you will only pay $45 to see that doctor. You do not need to pay the $1,800 first. The $75 for a specialist. And then down here, you're going to see diagnostic lab and x-ray. Now, this is kind of confusing. You're going to see more and more of this in the insurance business where they have 2 different kind of benefits. If you go get x-rays or lab work at a freestanding, non-hospital owned facility, then you're going to pay a lower copay than if you go to an OP hospital, so outpatient hospital. So if you went to a hospital environment and you got an x-ray or you got blood work, you're going to pay more for these benefits. All right. So you see the deductible waived here as well for the freestanding, for diagnostic lab, so this is blood work, $45, $80 for a x-ray. And then if you did it in a hospital, you would have to meet your deductible and then pay 35% for lab work, but $130 for an x-ray. So the question, of course, is, well, how do I make sure that I go to the freestanding facility? And what I would advise you is, if you are in a situation where you need blood work, you need an x-ray, you need an MRI, CAT scan, PET scan, whatever it may be, call the member services number on your ID card and say to them, I need these services. How do I get to a freestanding facility? Or how do I find a place that's a little bit lower cost for me? And they will help direct you to these people. All right. Down here at chiropractic, you see you've got deductible waived for 20 visits a year. Prescription drugs, there is a brand name drug deductible. All right. So if you need to take brand name drugs, you will pay the first $300. And then you get these copays of $75 or $115. Generic drugs at $20 are not applicable to this brand name drug deductible. All right. And also a note, every dollar you spend, $20 for generic drugs, $15 for chiropractic, $45 for physical therapy, $75 for a specialist, all of these dollars are accumulating towards your $8,350 out-of-pocket maximum. All right. So if you were to hit this $8,350, then you would pay nothing for prescription drugs. You pay nothing for doctor visits, nothing for surgeries, none of it. All right. So that's why this out-of-pocket maximum is an important number. Down here at the bottom, we get hospital stay, outpatient surgery, emergency room. All right. These are the big ticket items. These are the things that cost the most. And they always freak people out because it says 35% after DED, meaning after you pay your $1,800 deductible, you pay 35% of the cost. So everybody gets freaked out here. They say, oh my God, if I have a $100,000 claim, I'm on the hook for $35,000. No. The way that this would work, and I'll give you a real live, well, not a real live example, hopefully, but a real live fake example of me in a car accident, and I'm in the hospital for a week, and I got $1 million in claims, ICU, surgeries, anesthesia, the whole thing. I would pay 100% of the cost for the first $1,800. That's my deductible. Then I would pay 35%. Blue Shield pays 65% until my $1,800 plus my 35% plus any of these other benefits hits $8,350. Once I've hit $8,350 collectively, whether it's a whole bunch of specialist visits, whether it's just prescription drugs, or whether it's one big major catastrophic event, once you hit $8,350, Blue Shield then pays 100% of the cost for the rest of the calendar year, and you pay zero. All right. So that $1 million claim, if I had not used my plan at all, would cost me $8,350. Now, let's say I had an MRI and it cost me, $1,000. Then I only have $800 left of my deductible and only $7,350 left of my out-of-pocket maximum. And this $8,350 does include this $1,800 deductible. Okay. Last thing, you'll notice that there's another number here for family, for deductible, and for out-of-pocket max. These numbers are double. If you are enrolling by yourself, you don't even need to worry about this at all. Okay. If you are enrolling plus a spouse, plus a child, plus children, plus a spouse and children, domestic partner and children, this means that you would have a $3,600 deductible for family and $16,700 for family out-of-pocket maximum. The term embedded right next to it means that there's really two $1,800 deductibles embedded here. So in this example where I had that $1 million problem, the car accident, the week in the hospital, it's me, my wife, and 3 kids on this plan. I have met my deductible in full at $1,800, and I've met my out-of-pocket maximum in full at $8,350. I have 100% coverage for the rest of the calendar year, just like we talked about before. My family would now have the other $1,800 collectively, so they could spend, 2 of them can spend $900, and that gets them to $1,800. And then the rest of the family would have the other $8,350 in out-of-pocket maximum. So the term embedded basically means no one person in the family unit would be on the hook for any more than their individual deductible or individual out-of-pocket maximum, which is a good thing. And then no family on the aggregate would pay any more than $16,700. So if we are all in the same car accident, our maximum out-of-pocket would be $16,700. Okay. I won't go through such painful detail in the following slides, but I definitely wanted to orient you guys all to the terminology in place. And for those of you that want a good PPO plan, that don't want to pay a ton of money, but don't want to have a ton of exposure, the silver PPO plan is the medium porridge. It's a nice, right in the middle road, really good value for a PPO plan. Here's our gold plan. You'll notice right off the bat, the biggest difference with the gold plan than the silver plan is that deductible. It's zero now. So you're never on the hook for 100% of anything. Notice the out-of-pocket maximum is a little bit lower at $8,100, not a lot lower. So if you know you're going to max out your plan, the gold plan doesn't really save you a whole lot of money. If you know you're going to have all kinds of big things, the silver plan might work just as well for you as the gold plan because the out-of-pocket maximum is almost the same. But when you get into the other benefits, such as doctor visits, you're at 25 for a regular doctor, 50 for specialist, whereas our silver plan was 45 and 75. And then if we get our diagnostic lab and x-ray, lower copays, freestanding, everything is a little bit lower. There's no deductible for brand name drugs. The copays are much more palatable. So for those of you that might have a lot of brand name drugs, the gold plan could be a really good buy for you. And then we have our 30% here. Again, if I were in the hospital and I had the $1 million claim, I'd pay 30% up to $8,100, and then Blue Shield pays 100%. And you see our copays are a little bit lower for urgent care as well. So that is the big difference with the gold plan, is that deductible. And really, truly, with all three of these plans, it's all about that deductible and those copay amounts. So our bronze plan, high deductible, only 3 doctor visit copays. Gold, our silver plan, middle of the road deductible, lower copays, unlimited copays, and then our gold plan is 0 deductible with lower copays across the board. For those of you that know you have a number of expenses, maybe you know you have MRIs, you have regular prescription drugs, the gold plans could be a really good buy for you. And quickly, we'll talk about our HMO plans. For those of you that reside in California, you will be eligible to choose these. For those of you that live outside of California, you will not see these in your enrollment portal. And this is just another way you can access a plan that's a little bit lower cost. HMO plans are going to cost you less per paycheck, but keep in mind you have a much smaller network of providers than you would with a regular, with a PPO plan. So HMO plans, less cost, less choice, and also you have to pick a primary care provider and always go to that provider. You must stay within the medical group for all your specialties and all your services. So there are some limitations with HMO plans. Not many of you have elected these HMO plans, but for any of you in California that would like to save some money, have a nice health plan, but understand that there are some limitations, this is a good option for you. One thing I will point out here at the very bottom is this gold plan. For the big ticket items, there's no percentages. Remember on our previous plans, we were looking at percentages. Even the silver plan, we have a 40% coinsurance. With the gold trio plan, you pay only $600 a day for up to 5 days, and then you don't pay any more for hospital stays, only $300 for surgery, $325 copay for emergency room. So California employees, keep this in mind. It couldn't be a good option for you, but a lot less choice. All right, I'm going to pause there. Is there anybody with any questions on any of the medical plans we just discussed? Okay. So just a quick note, you'll be able to find a lot of these documents in the enrollment portal, but mental health has been such a big thing over this last couple of years with COVID. So I just wanted to kind of call out some of the benefits that are available to you. With Blue Shield, if you're a Blue Shield member, you have access to the Headspace app. Many of you might have heard of this Headspace app. This is a really great way. It's a meditation app, reduce stress, all these kind of things. It's free to you, and you can find that. There's a link at the very bottom there. It says www.wellvolution.com/mental health. So once you're enrolled and have an ID number, you can use this benefit. Also for some of the other things where you need a live person to talk to, there's a telebehavioral health hotline. So if you've got anything going on with mental health, substance abuse, depression, anxiety, you need childcare help, any of these things, the instructions on how to log into that are at the bottom of the flyer there too. All of these flyers are loaded into the documents page of our enrollment portal. So just wanted to call that out. This is free benefits to you, and ones that can really be helpful, especially if things are tough, which for all of us, we're all going through something at one point or another. So this is a good one for you. Okay, dental, vision, nothing really changing here. Some of the prices went down a couple bucks, so that's good. We have our dental HMO plan. Again, this is for California only employees. Dental HMO plans are going to be a far cheaper way to access dental coverage, but you have much less choice of who you can see. So if you take an HMO dental plan, just know that you have to go to a primary care provider. You have to always go to that primary dentist and be referred out from that dentist. You do not get to have quite as much choice in some of these things. You do get to choose your primary care dentist, but keep in mind they got to be in the Delta Care USA HMO network. So there's two of these different plans here. Both of them are very, very good. And the Delta HMO network is as good as you're going to find with HMO dental plans. So for California employees that just want a couple of free cleanings and don't want to pay a whole heck of a lot for their dental plans, these HMO dental plans are great for you. MetLife is our PPO dental provider. So we have three different levels here. We have our gold plan, our platinum plan, and our platinum plus. So the big difference you're going to find really is down here at the bottom on the calendar year max. All right. So calendar year max with dental PPO works exactly the opposite that it did with our medical plans. Remember with medical, we talked about once you hit a certain number, you pay nothing else. The insurance company pays 100%. Well, with dental PPO plans, it's the exact opposite. Once you hit your calendar year maximum, they no longer pay and you pay everything else. All right. So that's important to note. So if you got a lot of work to do, don't buy the gold PPO plan because they're gonna stop your benefits at $1,250, and then after that, you will still get the MetLife discounted PPO dental rate, but they're not going to pay any more towards it. All right. Our platinum plan is a much higher maximum benefit of $2,250, and our platinum plus goes up to $2,500. Now the platinum plus, the big difference between platinum and platinum plus is the out-of-network benefits. So when you take the platinum PPO plan and you go to a non-network or non-contracted dentist, the benefits are okay. They're not even that great. So you want to stay in network as best you can. But for those of you that are seeing a dentist that doesn't take insurance at all, maybe the Platinum Plus plan would work pretty well for you because the out-of-network benefits for non-contracted providers are much better, really good, in fact, compared to these other two plans. So if you're going to see an out-of-network dentist, choose that Platinum Plus plan. It could work pretty well for you. Quick note about how you could use these plans to your advantage. When we talked about medical plans, we talked about deductibles and out-of-pocket maximums. And once you get to a certain number, you're done for the year. Well, done for the year with medical means the calendar year, means on December 31st, you're paid, you don't have to pay anything through that time. And on January 1st, your deductibles and everything start over. All right. A similar thing happens with PPO dental plans, except it's the inverse. So if I were to enroll in this Platinum Plus PPO plan, I could, from May 1st to December 31st, use $2,500 in benefits. And on January 1st, the new calendar year, I get my $2,500 again. So that's very important because if you've got a lot of work to do, you could choose one of these PPO plans. You could use it all the way up between now and the end of the year, December 31st. And on January 1st, you get another $2,500. You get more work done. And next year at this time, you dump the PPO plan completely. You don't need it anymore. So you'd pay for 12 months of benefits, but you'd get 2 years of annual maximums. So that's kind of a way you can stick it to the man a little bit and make these plans work for you a lot better. So that is a nice little trick of the trade there with PPO dental plans. So on January 1st, you get your annual maximum all over again. So keep that in mind. Any questions on dental before I move on to vision? Okay. So our vision plan stays the same. You'll see that every 12 months, you're going to have access to a $15 copay for an exam. Every 12 months, you're going to get a $30 copay for lenses or lens enhancements, okay, every 12 months. Every 24 months, you're going to get a $180 allowance for frames and $200 for any of their featured frame brands. And then contacts, if you need these instead of glasses, you get a $180 allowance for contacts every 12 months, okay? And then here's some of the other benefits. Again, you'll be able to look at this in the enrollment portal. We only have the one vision plan. There's not much to compare it to. If you need vision, it's a good one. It's VSP. It's the name brand when it comes to vision plans. If you don't have any need for vision, I would just skip it completely and waive the benefit. Any questions on vision? All right, so let's talk about our enrollment. So we use an enrollment portal called Ease. Most of you should be familiar with it, having logged in once or twice before. Maybe it's been all the way since last year. So this is where we're going to do everything. There's no paper involved in this. And this is where you will find out what your plans would cost, okay? These plans are all age rated. So if you're 29, it's a different rate than 31, is different than 32, is different than 33. So this presentation you're watching right now does not include any numbers as far as your premium, because every single one of you have a different number. Unless it's the same exact plan and you're the same exact age as your coworker, it's going to be a different price. So this is where we can, this is where you will log in to find out the benefits, the rates, finding doctors and other different resources that might be available to you. When you get the email, which I'm going to go into in just a second, you'll be taken to the login page. If you've never logged in before, you're going to see this here. You'll choose a password, you'll confirm your password, you'll agree to the terms and conditions, and you'll be off to the races from there. So I'm going to do a quick tutorial of this. So this is going to be the email you guys are all going to see here shortly. I'm going to send it just after we get done with this meeting. You'll click the little login button here, and you're going to be taken to this page, okay? So you're going to put in your username and password. If you've not done this before, you'll have to choose your own password, login and password. It will look like this when you log in. So if you've chosen things in the past, it's going to show you what you've chosen. On the left side here, this is our documents page. So if you want to see any of the benefits that we kind of talked about a little bit ago, you're going to see all kinds of stuff loaded in here, especially this tiered network flyer for Tandem PPO. So remember, there's a different network of pharmacies, level A, level B. So this will help you understand where you can go to use a pharmacy that's a little bit less expensive, okay? So this is where we'll land. We're going to start enrollment. It's going to tell you what to expect. I'm going to load this presentation into here. So if you wanted to watch this again, if you're a glutton for punishment, you can click right there and you can watch this presentation again. You're going to load all of your information here. Pay attention to all the asterisks there. Continue. Dependents. If you have any dependents, please load them into this part of the system. Loading them into your dependents portion of the portal does not enroll them in anything, but it does allow you to understand exactly how much it would be if you were to enroll your spouse, if you were to enroll your kids. This is helpful if maybe you have another offering of coverage. Maybe your spouse works for the school district or another company, and you want to kind of compare and contrast how much it would cost to add the kids to your plan versus the other plan. So once you have them loaded in here, go ahead and hit continue. If you're on Medicare, you'd add it here. Most of you are not. Continue. Now we're getting to our benefits. So you'll see I've already been through here. So on the right side, it's going to show you exactly what my per paycheck cost is, all right? I've enrolled myself and my spouse. I've waived my daughter, okay? Watch what happens. Speaking of loading your spouse, your kids in there, dependents in there, watch over here on the right. If I choose to enroll my daughter, the numbers change instantly. So I can see instantly that adding my daughter is going to be $71.03 more per paycheck. Okay, so I compare that to what my spouse's plan would be, and I can understand better. So we'll waive the child for now. It shows me here I was on the silver full PPO plan before. That's my current plan. And now I've got all these blue buttons to select a new plan. It's selecting my Blue Shield silver PPO plan already, so it's already done. So if I want that plan, I'll just keep going. Notice there's a number of links down here that can be helpful to you. Links to find a provider. For those of you looking at HMO plans, you'll see video tutorials on how to find a provider. All of these links are live and they can help you understand what's available, good resources for you. A quick pause. For those of you who have never logged into the site, the number one issue we see people do is they get here and they scroll right down here and they're looking for something to do. They're looking for something to click. You must hit the check mark to say you would like to enroll, or that X to see you would like to waive. If you've never logged in before, this is all going to be gray. And if you scoot past it, you're not going to have anything to select. It's just going to show you all this stuff, but nothing to select. So make sure that you're hitting the check mark or the X, or else none of these blue buttons will show up. Okay. All right, so we've chosen our plan. We're going to hit continue. Dental plan, I'm going to go ahead and enroll everybody in the dental plan. I was on the PPO plan last year, and now I'm on the PPO plan again. Great. Here's my benefit summary. Here's my directory on how to find a dentist. Perfect. I'll keep that just the way it is. Continue. Vision, I'm just going to take vision for myself. I can't see anything. My wife and kids are totally fine. So there's my old plan. There's my new plan. Here's my prices. Okay, great. Here's some links to help you out. Continue. And then we get into some of our benefits that are paid for by the company. So this amount is based on the income that is input into the enrollment portal. If it's not up to date, we will work with your company to make sure it is up to date. Nothing much to do. It'll be pre-selected for you. You'll just hit continue. We got some life insurance here. We'll hit continue. We got another one. It's all paid for. Continue. Then we get to our voluntary life and AD&D. Now, if you did not choose this in the past and you declined this before and wish to enroll in it now, you are going to be asked to fill out some health questions. All right, so you have one time you can enroll in this guaranteed, no questions asked, and that's when you're first hired. So for those of you that are going to be enrolling for the first time, you can choose up to $40,000 with no questions asked. You'll notice that we start getting asterisks next to this. If you get to any of these numbers, this is all going to be something where you have to fill out extra health information in order to qualify. All right, so I've chosen the 40,000. It's going to be $1.64 a pay period. Okay, it gives me, there's some other links you can look at. Perfect, great. Saving. Beneficiaries, remember this has got to add up to 100%. If it doesn't, it won't let you through. Primary and secondary. So secondary is if you and your spouse were to die, then the daughter gets the rest of it. So a secondary or contingent beneficiary is helpful should your primary beneficiary no longer be around when you were to pass. All right. I do not need to fill out any health information because I didn't choose an amount that was over my guaranteed issue amount. I will continue. Here's my summary. You'll look at it, you'll see the per paycheck cost of all these things. If any of it's incorrect, like say I didn't want to enroll my child here, I could hit edit and then decline for the child. Assuming it's all correct, I hit continue. I'm going to sign my forms. Now, for those of you who have used DocuSign in the past, it's going to be very similar to this. So it's going to ask me to type my signature one time, and then I'll use my mouse to enter my signature. So it should populate here in just a second. I will type in my signature when it lets me. Come on, come on. Let's go. Okay. Any questions on any of this stuff while we're waiting on technology? Okay, so once you've signed that with your type signature and your wet signature with your mouse, or if you're on a laptop, or if you're on an iPad or your phone, you'll use your finger to sign.
Hey, Bill.
Yes.
Sorry, I couldn't get it unmute.
Oh.
I had a quick question. For dental and vision, with these Blue Shield plans, are children still covered for dental and vision under the medical plans if they're under 19?
Yes, they are. Yes,
Okay.
they are. So just to be very clear about that, and here I am finishing, and here are my signatures here real quick.
Yeah.
It's going to take this. Just I'm going to answer you very specifically in detail, Sherilyn, because I know others will have that same question. So you'll just go through this whole thing. You'll hit all the signature boxes that they want you to sign, and then you'll go back to the top. If you are so inclined, you can scroll through and you can see your application. If not, you're going to hit finish signing, and then you'll hit finish here again. And once you're taken back to this home page, you will, it'll say manage enrollment now, and you're going to get an email that says, thank you so much for submitting your benefits. You are all done. Once you get that email, you are done. You can log out. We're not going to bug you anymore. For those of you that don't get all the way there, we're going to continue to bug you to complete this. So Sherilyn's question was the dental plans, and I'm sorry, medical plans, and do they cover dental? And the answer is yes. So if you enroll your child that is under the age of 19, so all the way through 18 and 364 days, they can be on, if they're on your medical plan, they are covered with a pediatric dental and vision benefit. So this is very helpful for those of you that have kids. My kids are 9 and 11, and we don't really have their own dental plans. They just use the pediatric dental plan through the medical coverage. And they are legitimate dental plans. It's not just an exam and see you later. They are legitimate dental plans, and they can service the needs of your children under the age of 19, as long as it's not too major of a thing. Now, it can still cover major things. It does not cover orthodontia, but it covers cavities, it covers x-rays, it covers cleanings, these kind of things. And if you enroll your child on the medical plan, they will have coverage for that. In this situation here, I have enrolled me and my spouse and not my daughter. My daughter would not have pediatric dental coverage on this plan because she's not enrolled in the medical plan. Okay, so that's the key. You must have a child under 19 and enrolled into the medical plan. Once you do that, then you're covered. Your child would be covered for dental and vision until they turn 19. Did that help, Sherilyn?
Yes, because I get asked all the time, and I'm telling people that yes, it is true. So I wanted to make sure I'm not lying.
Yep. So here on the left, here we got our documents: Blue Shield California Pediatric Dental and Vision FAQ. So this is a great way to understand how to go about using this, where you would go to find providers, what you need to tell them. And then, of course, if you have any questions, you can always call your member services number, and they can help kind of walk you through that. So that's where you would find that information there. Let's get back to where we were. So this is our login, prosafe.ease.com is where you're going. You're going to get an email from me, so you don't need to worry about that. So what do you do now? You're going to look for this email, which will be coming to all of you very shortly. Go ahead and log in, enroll, and if you got any questions or you need any answers, I will take them right now. Or if you need help, next week, April 12th at 11 a.m. Pacific Standard Time, we'll be doing a follow-up open forum question and answer period. So that is the end of my presentation. I thank you guys very much for sticking around. If there's anybody that has questions on anything that we covered, anything we didn't cover, anything that's been bugging you, you want help on anything regarding any of our benefits, now's the time to answer questions. If you're all set and you got what you need, you're welcome to sign off now, and I appreciate you being here. So I will shut up and take any questions.
I just have another one. Can you explain, and it doesn't have to be today, but about dental or vision cards? I get asked that often. I didn't get my dental card, I didn't get my vision card, and they don't get them.
Yeah. So your dental and vision benefit, your ID number is your name, date of birth, social security number. If anybody, I think some of these companies still do, you can go in and proactively ask for them to be mailed out to you, but you need to call MetLife, you need to call VSP and do that. Okay. If you were to take an HMO dental plan, you'll get an ID card for that.
Okay. I'm just trying to think of all the questions I get, but with you giving out your number, that should help.
Yeah.
Okay, I'm good.
Okay.
Thank you, Paul.
Somebody else unmuted themselves, so.
I'm good. I was just going to let you know I'm good. Thank
Okay.
you.
Okay, great. All right, thank you guys. I'm going to stick around until the last one of you leaves because sometimes there's private questions, and if that's you, I will stick around until everybody's gone. But otherwise, thank you guys very much.
I think they all just have you on mute. No, I'm just kidding.
Looks like
All right. So I'll talk to you later, Bill.
all right, thanks, Sherilyn. Hey, oh,
Oh, wait.
Sherilyn,
He's leaving.
was that?
Yeah, I was going to wait for
Okay.
everybody else to hang out.
I am.
All right, thanks, guys.
Thank you.
Thanks, Pat.
All right.
All right, bye.
Sherilyn, you're okay with me shooting this email off right now?
The email is just going to be the video, correct?
No, the email is going to be the invitation to log on and enroll.
Oh yeah, I'm good with it.
Okay.
Honestly, I'm good with it. And
I'm gonna save this. I'm gonna actually stop recording.